So now we're going to be looking at sharp dull, and we're going to be focused on the hand for this. Just kind of to orient you to this diagram, this is what we'll be using us to guide us in where we test. So you can see here, spots 1, 2, and 3 are used to test the ulnar side of the hand. 5 and 6 are used to test the median side of the hand. 4 is used to test the radial side of the hand, but what you want to be careful of in this picture, it looks like it's kind of in the medial part of the palm, but for it to truly test the radial side of the hand, you need to be more on this lateral side. Okay, and I'll show you that when we test also. The other part of the picture is here, number 7. This is the dorsal side of the hand, again along the thumb. Sorry about that. This will also be used to test the radial side of the hand. In terms of setup, you'll see that I've got her on putty, and what we're doing is we're placing her hand on a more secure surface so that when we test sharp dull, she's able to focus on the sensation of sharp and dull and not on the movement of her hand. So this stabilizes her hand so that she doesn't sense movement. If I just support her hand here and say I was testing light touch and I pushed on her finger, if I moved her finger at all, she's not only receiving information about light touch, she's also receiving sensation about movement. So we want to eliminate movement, and we do that by placing them on putty. When you test sharp dull, you can test with paper clips. You can use a paper clip if this one was still bent in its normal curled up position. You could use the bent rounded position for dull and the unbent position for sharp, which is also used to test pain. The other option is to use a safety pin. Okay, so again, this rounded portion being for dull and the pointed end being for sharp or pain. But obviously, if you pull this out with a patient, you're going to make them a little bit nervous. So it's really important for you as a clinician to explain what you're doing and why you're doing it. I would also recommend that you test it on yourself so that you know what it feels like and you know how much pressure to give. So for my patient here, I'm going to use a safety pin, and it's just to see how well you're able to distinguish sharp from dull in your hand. What I'm gonna do is this soft side is gonna be used for dull, and I'll show you on myself here. I'm just gonna be pushing on different places of your hand. Okay, versus the sharp end here. I'm gonna just push a little bit. It's not meant to be hard. It's not meant to cause true pain or, of course, draw any blood. I don't want to do that either. So I want you to experience that first with your hand that doesn't have any deficits and with your eyes open so you know what to expect.
Okay.
This, and I'm going to switch hands here. This is obviously the dull side. Okay, so you kind of get an idea of what that feels like. And then for the sharp side, this is what this feels like. Okay, was that okay?
Mm-hmm.
Okay. So now you can kind of see the difference also between sharp and dull.
Right.
So we're going to do that for this hand. So when we're testing sensation, we're asking the patient to close their eyes. Some people are unable to keep their eyes closed for the duration of the test, and so what you might consider also is putting a sheet up in front of their face just to block their view of their hand so the test isn't skewed by their vision. I trust my patient, though, that she can keep her eyes closed, so I'm going to just now at this point I'm going to have you close your eyes, and I want you to tell me when you feel either sharp or dull.
Okay.
And I'm going to use my paper to just help guide me on where to test. Okay, so here we go.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. sharp, dull, dull.
Now, for the purposes of instruction, I'm going to tell you guys that make sure when we do test the radial side of the hand that we really come out to the lateral side of the thumb when you're testing the volar side, so that you can make sure you're capturing radial sensation and not median sensation. So I'm going to start testing again.
Dull, sharp, dull,
Okay, and now I'm going to ask you to flip your hand over. Okay, eyes are closed again.
dull, dull, sharp.
Okay, and relax. You can open your eyes. So one thing you may have noticed again during this testing is you try and vary your speed so that they don't get used to responding in a timely manner. So don't hesitate to take pauses. Don't hesitate to repeat a test if you're unsure or if the client is unsure. That is okay also.